Hi guys, I want to talk about two subjects in healthcare right now. The Stanford microbiologist gave a very recent article that is interesting. He said that virus is tracking the not we are tracking the virus behavior. Actually, virus is in other way around is doing it right now. Virus is tracking our behavior. Very interesting from a Stanford microbiologist. If you think about that, so you have to remember the virus is, I did a show with Anirban Bandyopadhyaya. Is a experimental physicist from Japan, and also is an author of a book called Nano Brain. I interviewed him. We can watch that interview on my webcast. What he said was, if there is a true war between the virus and the humans are going to lose. So it is very interesting. Then I want to talk with you about the opioids. That's another. PBS had a frontline major program on opioids, war against opioids, and particularly an Indian-born businessman. His name is John Kapoor. Kapoor family, Kapoor, his name is a very well known in the movie industry in India. He's a Mumbai, Bollywood is very famous, Kapoor families. But Kapoor is a very common name like Smith. But John Kapoor is a brilliant guy, and he went to school in Mumbai Chemical Institute. He did masters there, I think. Then he came back to the United States and did PhD in Rochester or somewhere in Buffalo, New York. Then he started working for a company called a company working for a chemical company, a pharmaceutical company. He has a PhD in pharmaceutical sciences, actually. Then what he did was interesting. He bought a Stone Container Corporation, a corporation they collect, they make a paper package products. All packages they make it, but very strange, as strange as it is in the nowadays. This Stone Container Corporation, a paper packaging company, owns a company called Lifomed. Lifomed is a drug for urinary tract infection, I think, mostly. So he bought that company for $24,000, just $24,000 in 1990s, the early 90s. Then he sold that company to, guess what? How much he sold it for? $800 million. Okay, almost $1 billion. He sold that company to Japanese company called Fujisawa. Japanese were trying to get into the healthcare pharmaceutical market in the United States. Takada is one of them. There is several Japanese companies are really they're aggressive in getting into the pharmaceutical industry in the United States. So Lifomed, he sold it. Then he started a company. Bought a company in California from Sutter Health. It is called Options Care. It's an infusion company, and he franchised it, and he did a brilliant job on it, and he made a lot of money. He invested in several startups, pharmaceutical companies. One of them, I can tell you, very interesting. So there are certain drugs works for particular people. Suppose a drug is a very rare condition, and plus you have hypertension, or you have a rare condition and a common disease, a combination of diseases, that drug works very good. But the big companies, they get a FDA approval, but they don't bring to the market. Very strange. This is what the pharmaceutical companies do. They don't bring these. If there is no potential $1 billion market, they don't bring it to the market. So that drug dies, even though it's useful for certain people, because there is not a market potential. So John Kapoor did was he funded those companies that you can take those patents from Merck and Pfizer and big companies, and start his own company, and funded those companies. That's a brilliant move in my view. Excellent. So he helped people that with a rare combination of diseases. Then he went into this company. He bought a company in from I think Ohio. Is subsys. He's a very innovator. So he invented, that he came from a very modest background actually in India. He started a company called Subsys. Subsys is a spray for fentanyl. Fentanyl, the highly addictive drug called fentanyl, as you know, is like heroin. Heroin more potent than heroin, in fact. So fentanyl, he bought that drug and then this is for cancer pains and very serious pains. People can use it and then it is very useful. But he was not making money, he's losing money. So he doesn't want to lose money. He just invested $80 million. He is a billionaire, multi-billionaire, but his greed was taken over him, his egoism taken over him. And he says that I'm not going to lose this money. I'm going to bring some shady characters to the executive board, and he bought them. The shady characters they started bribing doctors all over the country. So because they wanted to use it for just regular pains, if a fibromyalgia, any pains, chronic pains, all these pains they want to use for is not supposed to use. It's not meant for that kind of pains. It is serious, highly potent, highly dangerous drug. So several few people died because of that drug. So federal government started investigating John Kapoor, and they were bribing all over the doctors and a speaker fee and all kinds of nonsense. See the Frontline article. So they indicted him, convicted him, sentenced him for 5.5 years in jail. Okay, he has not gone to jail. He is appealing to that. He's a 79-year-old. He doesn't need money at this age. I don't know why he wants to prove that he's right. So, what is opioid case? I remember when I was living in New York. I used to go to parties in Wall Street parties. Some of my friends are from Wall Street, first Boston. I used to go to their parties. The cocaine, the drug was flowing everywhere at that time, 1980s and 90s. The flowing, they're bringing in a plates the cocaine. Everybody snorting. I definitely was against it, and I never did it. So it was so common in the parties in 1980s in New York. Okay, if you go to Boston, any investment parties in Wall Street, that is common thing they're offering. So there is a club called the Palladium, and then the Limelight, which is the Studio 54 became a Limelight, and then we joined in that forces in that Limelight. We used to go there. So the government thought war on drugs. They started a war on drugs. The reason is, I want to tell you a precursor to this opioid addiction in this United States. So government said that, this is a war on drugs and no to drugs and all this war against drugs, but they relaxed all the rules for the pharmaceutical companies. So these people who are addicted to cocaine and all those things, they started buying the prescription drugs. So then prescription, the Pfizer and American, all these companies making billions of dollars on these opioid drugs, and they started treating psychiatric drugs, and they are giving a lot of indirect fee and all those things to these companies. So actually this is evolved into the addiction to the entire country, became more dangerous than cocaine, in fact, this opioid problem. So Subsys did not help that he was making it so easy to buy a spray. Just put a spray, and then you can put the skin pores can take that drug, and then you can get a high on that process. So I think that you need to watch that show. It's very interesting. It is on PBS, Public Broadcasting Corporation, PBS. I will give a link on this video if you want to look at it. It is fascinating to watch that thing. Thank you for watching. Thank you. Bye.